Breaking news. 4 top CDC officials have just resigned, citing political pressure and the weaponization of public health. The Centers for Disease Control and Prevention is now reeling from a historic leadership shakeup. Let's break down what's happening. First, what happened? At least 4 senior officials resigned, including leaders of major CDC centers. On Wednesday, CDC Director Susan Menarez was fired after refusing to resign under pressure. Officials say pressure came from the Department of Health and Human Services leadership. One resignation letter said, they accused the administration of politicizing science and limiting CDC communications. Questions are now swirling about what happens next. Officials and public health experts are warning of serious consequences. Some of the nation's most experienced infectious disease experts are now gone. Their departures may affect preparedness for future outbreaks. Why does this matter? The CDC is America's front line for disease detection, response, and guidance. From flu outbreaks to emerging pandemics, the agency coordinates responses nationwide. Losing senior experts reduces institutional knowledge and operational capacity. Public health leaders warn this decapitation could be a disaster. The resignations follow new CDC restrictions on COVID vaccine eligibility. Critics say political appointees are overriding science and putting Americans at risk. Meanwhile, rising misinformation about vaccines is fueling real-world consequences. One resigning official cited a spike in measles cases as part of the concern. The CDC was also the target of a violent attack linked to vaccine conspiracy theories. Experts say the loss of experienced staff makes the country less safe and less prepared. Preparedness metrics and public trust could decline if expertise is sidelined. The CDC is at a crossroads. Here's the bottom line. The CDC's ability to respond may be weakened, and public trust is at stake. Online, the country is divided. Some applaud the shakeup and call for more accountability. Others are outraged, fearing expertise is being sidelined for politics. Comment sections are full of heated debate. "Good riddance, drain the swamp," reads one post. Another asks, "This is terrifying. Who will protect us in the next outbreak?" So we ask, do you trust America's public health system? People are choosing sides online and in communities across the country. Bottom line, the CDC is at a crossroads, and consequences are only beginning to unfold. The next public health emergency may test the system in ways we can't yet predict. Do you trust America's public health system? Let me know your thoughts in the comments. For updates, subscribe and check sources linked below.